Hi, everybody. Heather Taylor, Eat Well and Beyond, where food is your medicine. And I'm here to just talk a little bit about why would you want to use a nutrition professional known as a dietitian. First of all, we are the nutrition professionals who are able to take insurance, so that's a great barrier to eliminate. We're also very highly skilled in multiple areas. Some people go into dietetics to work with children. Some people go into something more specific, like specifically diabetes or specifically renal or kidney. Sometimes it's cancer care. But a lot of dietitians have have been in a lot of different areas, from working in gyms, doing nutrition plans, working in food service, doing research. And we're all kind of in the same camp where we really believe in food as your medicine. We believe that food should be used in a way to help you heal, and it's very specific for very different reasons, and for everybody. Everybody's very different, right? So one person might come in with a symptom and another person comes in with a similar symptom, but it can be from a host of many different reasons or causes. I like going into functional medicine, so that's the study of the function of the body as a whole. So I've always been very holistic, and I've worked in areas like I've worked in gyms and fitness centers. I've worked with athletes and sports nutrition. I've worked with children, sensory issues. I worked in food service in schools. I was a WIC nutritionist. I worked as a manager for Head Start in the nutrition area. I worked in the juvenile corrections facility. I worked with the Army National Guard. I worked in a lot of different places, and my favorite, though, has been my private practice, which I've been in almost 15 years now. We're going into 2025, and I have been a dietitian for 25 years, so I've done a lot of different things, but I think the last 15 years have probably been my favorite because functional medicine or functional nutrition is really looking at how do I use food in a way to maximize and optimize your ability to heal and also rebalance the body. Make sure you're optimizing great all the way through your life, trying to decrease the risk of, disease and illness. And if you do have a sickness, how can we help you recover through nutrition? My favorite thing probably in the last few years was getting certified through the Monash University in IBS. So people have always known me to talk about the gut, and I love talking about the gut, the whole intestinal tract from the mouth all the way out, right? This whole tube that runs through us is very fascinating to me, and how it interacts with all the organs. It interacts with your immune system, your brain health, especially the immune system. We have all these illnesses and sicknesses and autoimmune things and, a lot more dementia and a lot of different things coming out right now, which are really being studied in terms of the microbiome. So our balance of our microbiome in our body are really important. And there's so many things that influence that. So when someone comes to see me thinking, hey, I want to lose weight, or I want to improve my blood sugars, or I don't want to go on medications, what can I do with my food to help me? Are there specific supplements? Are there certain types of diets I should be doing, certain types of foods to avoid? I really kind of hone in right into the gut and say, well, let's first make sure you're eating low inflammatory. What does that mean for you? First of all, we got to get the toxins out. That's a big one for us, is like really reducing the ultra processed foods, increasing more of our fresh and more higher quality foods. And how do we do that within our daily lives, with our financial situations? Are we, able to do planning? So when someone comes to see me as a dietitian, they're not just getting a plan and I'm heading them out the door. We're sitting and doing a lot of education first. So there's education and coaching involved in nutrition care. Okay. So trying to take a bunch of nutrition and learn it in 1 hour is pretty impossible. So multiple follow-ups is actually very, very highly recommended when you're working with a nutrition specialist, because it's very hard to retain a lot of information, especially if you have to go through either protocols or different steps or required to do additional testing to get more information. It can be a little bit of a journey learning about yourself and what you need, what works with your body and what doesn't. Certain diets can really throw you off too. So you might see something on Instagram or TikTok or something, and someone looks like they're very well versed in certain science, but maybe that science is a little more cherry picked, or maybe they're trying to sell a supplement, or they're trying to, sell a book on something that they really believe in. And there's a lot of different science out there, right? So we've had to really kind of sift through that. And that's our jobs as professionals, is to be able to sift through all this information, whether it be good information or misleading information. We are sifting through it all and seeing what makes sense in terms of the accumulation of science, and also how does that pertain to you individually and in particularly for your own health? Everybody's very different. We have different exposures, we have different genetics, we have different influences. So we need to make sure that it's tailored for you and you're learning what's the best way that's going to work for me. What is it about the science? What is about the science that doesn't work for me? What is about the science that does? And so talking to a professional, really getting a good background and working with somebody that's worked with many different people. You don't want someone that's just kind of doing marketing all the time and not working with patients. You want someone who's seen a wide variety of patients, gotten additional schooling in different types of labs, functional labs, food intolerance testing, microbiome stuff, a little bit more about maybe even hormone things with women, right? Or even men, right? So we have a lot of different things going on, and these labs aren't always covered by your insurance. A lot of the functional testing is kind of direct to lab, and they don't run insurance because there's a lot of blocks on certain labs, and sometimes there's like what we considered standard care, like good old lipid and CBC panel. But a lot of these other like kind of investigative type labs aren't covered yet. Hopefully they are in the future. The other thing that's great when I talked about having insurance coverage, it's still very, very all over the place when it comes to insurance. So trying to go see a nutrition professional with paying out of pocket can become very expensive. But one thing you need to know about insurance is that they're very particular. We have Medicare and we have Medicaid. One is federal, one is state run. Every state is very different in what they cover. I know in the state of New Hampshire, Medicaid is typically not covered for a lot of nutrition services. Medicare right now, through the federal government, is paying for diabetes care and kidney disease. Those are the two things. We're really waiting for the expansion bill to go through so that it can start extending that coverage to people who really need it. And we're looking for things to be covered like obesity, for weight loss. We're looking for hypertension and heart disease to be covered, autoimmune like celiac and other autoimmune diseases, digestive problems, IBS, a lot of constipation, loose stool, a lot of like microbiome kind of like GI issues. We're also looking for eating disorder coverage. So there's a lot of things that are still not covered through your insurance. So those would be something you either pay with an HSA or pay out of pocket or coordinate with some other type of insurance. Private insurance typically covers a lot of these things. So if you have those type of situations, most likely you're going to get nutrition coverage, nutrition education and counseling coverage through a private insurance. So the private insurances are more likely to be able to cover those things, which is great because we need a lot more covered. We need a lot more people kind of getting some nutrition education, making some behavior changes with their food. And it's not just diabetes and kidney disease, right? So hopefully that's in the future. But in the meantime, if you have private insurance, you're most likely going to get covered, okay? One thing you do want to do if you are going to use insurance, you do want to make sure there's like coordination of care. Do you need referrals? Are there any limits on your visits, co-pays, deductibles? That is something that is responsible of the patient, not of the provider. So you know, make sure that's covered so you're not getting stuck with the bill if it's not. So always make sure you're calling about your plan for nutrition counseling coverage. In terms of setting up an appointment, it's super easy with me. I do in office. I have an office in Manchester, and I also do telehealth. So if you're in the state of New Hampshire, and that's where my license is, where it covers, you can schedule either one of those. You can go to eatwellandbeyond.com, which is my website. There's an online option. You can actually enter in your insurance information, all that stuff in there too. If you have any questions, you can leave me a message. But that's a really great, quick way to do it. Sometimes I'm going to be in with patients, so it's sometimes hard to get a hold of me through phone. It might take me a day to get back to you. You can also email as well. So you have options in trying to reach me. And I'm looking soon to be hiring. So hopefully we'll have some more staff here at Eat Well and Beyond, some more dietitians that are going to be highly trained to be able to work with more patients. So if you have any practitioners you work with and they're looking for a dietitian to send, I know that a lot of them are very sparse in the clinics and hospitals. People are having to book out like 3 months where they can get in within like 2 weeks with me. So, and follow-ups are a lot more regular. I see behavior change happen a lot faster when you're having more contacts with somebody. There's a lot of great tools that I have. I have the InBody body composition testing machine. I also have tons of, like I said, those labs that we can run. I have the ability to give people a food tracker for free, and when you log it, it ends up in your file. So I can see everything you're logging. So it's a great way to stay in touch. Say, hey, Heather, check out what I'm eating. Am I doing what I'm supposed to be doing, or what can I be working on, right? Rather than carrying around the old like notebook to keep a diary. So Lots of tools, lots of ways to communicate. So if you are looking for a specialist in the world of nutrition, definitely reach out. Make sure you use those benefits to your advantage. We think that nutrition is a primary thing in terms of prevention. It is also primary in terms of healing, restoring energy, and helping you live your most optimal life. So check out eatwellandbeyond.com, and hopefully I'll see you soon. Take care.